I'm in southern Florida and we're here to see some real-life cases and try and document some real-life cases of how veterinarians are using the StableLab SA blood test in their clinical practice. The aim here is that our new customers want to understand how to adopt our product. We're going to try and catch some cases with some expert users so that they can see how these expert users are using the blood test in their daily clinical practice. Right now this morning, I'm at Palm Meadows racetrack in Florida. I'm going to meet with Dr. Luis Castro. We're going to look at some cases with him. So in order to try and pick up on some cases, we're going to screen 12 of 28 horses in total in the barn. So we're just going to pick horses that may have bled recently or that may have raced recently, or I believe one or two have just come back from hospital. So we're going to screen them and see what we come up with. So hopefully this will be interesting, and hopefully we're going to find some cases that people can learn something from. Good to see you.
How are you?
Good, and you?
Amy.
Hi, Louis.
How are you?
How are you?
Good to see you.
Good to see you too.
All right?
Yeah, great.
I've spoken and I've arranged with Graham Motion's barn
Fantastic.
to do as many as you can do for us there. Some of them are poor performance. Some of them had histories of fever. Some of them had a history of a bleed. It's coming back from pneumonia.
Okay, so we're kind of testing almost a third of the barn, really.
Yes.
Yeah.
Yeah. How many horses you got here right now?
Yeah, it's 28 now.
Okay, so almost half the barn. We just pulled blood from 12 of Graham Motion's horses with Dr. Castro, and I got them set up and I'm just going to run them now. And the idea here was we're just screening these horses. We don't know if there's anything wrong with them. We're just trying to make sure that there's not. 12 of the 28 or so horses that Dr. Castro elected to test, we now have the results, and I'm going to go back and I'm going to go through those horses with Dr. Castro just to get his response. I think it's really interesting to watch how it may actually influence his clinical assessment. You gave us a history on this horse earlier. It's just back from hospital for pleural pneumonia, if I remember correctly. So how do you feel it looks after coming back from hospital?
Well, it looks like it's been in the hospital for a week, so I know I wouldn't be surprised if it's elevated, but it's probably, hopefully, below 200.
Okay, and how was it discharged? What were the recommendations?
I haven't read them, to be honest. The horse just arrived, but
Okay.
I do know that the fibrinogen was 900 on
Okay.
this horse.
Okay, so its SAA is 458.
Okay. I don't think this horse is still on antibiotics, but for me, I may not jump on it. This horse has been on a lot of medication in the last 2 weeks, but it's something I'm going to definitely monitor.
Yeah.
But I would normally monitor her anyway if she just came back. By that I mean monitor her SAA.
So we're going to take a look at her again tomorrow. If her SA has gone up, you might do something about it.
Yeah.
If it's not moving, you might just keep monitoring her.
Yes.
Okay, so let's take a look again tomorrow.
That's what I'm going to do.
Okay, great.
She was ill about a month or so ago. Respiratory issue, SA elevated, on antibiotics. Ultrasounded, there was some pneumonia, but she resolved via ultrasound. We followed it via SAA, and she's been in training.
So as part of the screen here, where we just ran 12 of the 28 horses, her SA came in at 104.
Yeah.
Which is quite low, but still it's a positive.
Yeah, it is low. With a history, you worry about it. You worry about walled-off abscesses.
Okay.
They give an attenuated response, in my opinion,
Yeah.
of the SAA.
So what difference has that result made, if any?
We're going to ultrasound her chest, probably,
Okay.
once we get permission.
Would you have considered to do that without screening today?
No, not at all. She was running well, reached the 16th pole and stopped like the proverbial been shot in the head kind of deal. The horse has just stopped completely.
Okay. Any physical signs?
Orthopedically, he had no physical signs. He was scoped, scope was clean,
Okay.
and so there was no reason for the performance.
And today, how does he look?
He looks fine. He has no fever. And,
Okay, well, his SA was 1104.
yeah, that's very significant,
Yeah,
obviously.
yeah.
So that tells me there's an infection going on. The first place I would look, of course, in a racehorse that performed badly is the lungs. He's not showing any clinical signs, but that's kind of high for a non-clinical
Yeah.
horse,
Yeah,
which means that we may get a clinical sign soon.
yeah. So we would not have found him if we had not been screening today.
No, not at all.
And what's the next thing you're going to do with this horse then?
I'm going to pull a CBC and we're going to monitor him
Okay,
and probably take another SAA tomorrow. That's
Okay.
what we're going to do.
okay.
But we're probably going to end up on antibiotics.
So we've just finished screening with Dr. Castro, and from the 12 horses we had 3 that gave positive results. So we weren't actually expecting one, perhaps, that had just returned from hospital, but the others certainly not. And I think it's been very interesting, and we're going to come back here again tomorrow to follow up on those cases, to really understand how Dr. Castro not only uses it then to screen and pick up an infection, but also to monitor a case. So we'll be back tomorrow for some more testing.
So the horse that ran badly and no clinical signs, he was 1104 yesterday,
Yes,
surprisingly.
yes.
And now he's 783. So the drop is significant.
Yeah,
If you were to, you'd have to follow this horse, but today we're going to elect to ultrasound him
yeah,
because even though it's dropping, we know that historically abscessation of the lungs can attenuate that number, can make it smaller than normal. Plus, you don't want the horse to run another bad race. If he's got an issue, let's identify and let's treat it.
An interesting thing about that, however, is that if that's dropping, it would suggest that it may have peaked 2 or 3 days ago
On race day.
on race day.
Yeah.
So, that makes a very strong point or case for having pre-race tested this horse.
Oh, absolutely.
And it's a post-race testing to me doesn't make sense because the horse didn't run well, so let's try and find out why, but why not preempt with the diagnostics?
Well, because people need to find value in pre-race testing,
Yeah.
and this may be something that we'll start doing more often.
Yeah, well this
Because
unfortunately,
there's
we don't have a
nothing
pre-race test.
because there's nothing more expensive
Yeah,
than running a bad race.
yeah, absolutely.
How are we doing?
So he has a bunch of comet tails, and the flora is a little thick and rough here, and then he has 4 little, the bigger area here, granulomatous looking lesions or consolidation. Not a big abscess like the other one, but not normal, especially at 5. He's like very big.
2
centimeters.
2 centimeters.
Consolidation.
But
Abscess.
I'm getting that.
Well,
Yes, you bet.
That's huge. That's bigger than the other one. So far there's at least 3, and there's even smaller ones than that. The thing is that sometimes, the race sometimes will break them open, perhaps, and have some leakage, and then the SAA and fevers will come on. But it's hard to say whether his SAA would have been elevated only because they're encapsulated. Maybe they would have. Certainly, we have no clue, but it would have been nice to check before the race.
so you selected this guy for testing yesterday as part of our screen.
Yeah.
Is the only reason poor performance, or is there any other reason?
That was the only reason. Poor performance. The horse with an 1104 that had just ran 3 days ago went to about 780 or so. That drop is significant, but it still wasn't below 200. I found that under 200, you feel a little better about things. You can stop a treatment or maybe just monitor the horse. When we ultrasounded the 1104 horse, we found multiple abscesses on the right-hand side and some consolidation on the left-hand side. Abscesses were anywhere from 2 by 2 centimeters to 2 by 3 centimeters. They were small, but they were multifocal, probably 3 or 4. And some other areas in the mediastinum on the right-hand side that looked to be an abscess as well.
And is it likely that they were there before the performance?
Yeah, the performance was 3 or 4 days ago.
Yeah.
It takes more than 3 or 4 days to do that. Well, the cost is gets put in perspective when you lose a race that has a $30,000 purse.
Yeah.
And not only lose a race, but you perform badly. Using it as a pre-race screen can be incredibly valuable.
What we've done over the last couple of days has really shown that these veterinarians are using this in their clinical assessment. I mean, these are some of the best equine veterinarians in the world, and they're using the StableLab SA blood test to guide them, like a thermometer. I mean, it's a non-specific blood test, so the idea is that it can enhance and it can help in your clinical assessment and to know which direction to take. And that's really what we developed this test to be. It's a tool for veterinarians to be more veterinarians. It doesn't tell them what to do, it just helps them do what they do. I think Dr. Castro's cases in particular where, I mean, he was the person who elected the horses. He was the person who then decided, well, I suspect a pleural pneumonia. And I mean, he was using the test at each stage to guide him, but he was right. It's a more powerful tool for clinical assessment.